Chinmay?
Sir.
Yes. Yes.
Yeah. Good evening, everyone. Thank you, Dr. Vedi sir, for giving me an opportunity to be a part of this event. And I'm happy that today I'm going to present a brief introduction of Dr. P.V. Chalam sir. Sir is a Dean, Bhaskar Medical College, Hyderabad. Sir was a Professor of Surgery, Professor Head of the Department of Medical Education, Regional Center MET, Bhaskar Medical College, Hyderabad. Sir is an International Fellow in Medical Education, CIU SOM, Illinois, USA. Sir has done his MBBS and MS General Surgery from Gandhi Medical College. Sir has served mostly at Gandhi Medical College and retired from government services as HOD Surgery from Gandhi Medical College and joined Bhaskar Medical College as a principal in 2016. Sir is presently Officer in Charge for Regional Center for Medical Education BMC, Member PG Studies, Board KNRUHS. Sir is a member Institutional Ethics Committee, Nizam Institution of Medical Science. Sir is an external member, Faculty of Medicine, KLE Academy of Higher Education and Research, Belgaum. Sir is a member, Curriculum Committee of KNR University of Health Science. Sir has contributed to new competency-based UG curriculum. Sir is a founder president of Association of Medical Educationists. Served as a founder convener, Regional Center for Medical Education Technology, Gandhi Medical College, Secunderabad. Sir is officer on special duty at Dr. NTR University of Health Science from 2001 to 2003. Sir has served in UG PG study boards of NTR UHS, EMCET committee, conducted innumerable workshops on medical education technology, faculty development, and research methodology in medical college all over the state at NTRUHS Vijayawada. And sir has also has participated at national workshop at New Delhi. And sir has published many articles in index journals. And I'm happy to share that I have an opportunity to meet sir in person also. So sir, we are fortunate to have you to speak on the topic realization of competency-based medical education. Over to you, sir. Thank you. Thank you very much, sir.
Thank you, sir. Thank you for your kind introduction. All are able to hear me, sir? Please respond.
Yes, sir. We can hear you.
Yes, sir.
And you are able to see my first slide, realization of competency-based medical education?
Yes.
No, just wait.
Okay, sir. Okay, sir. So, good evening, everybody. And I bring greetings from Bhaskar Medical College, where I am working now, and also from Association of Medical Education. And at the outset, let me thank sincerely the MU India, and in particular, Dr. Sanjay Bedi and Dr. Tejender Singh, who have invited me to give this talk. So, what has prompted me to select this topic is, this gazette was published in November 2019, making competency-based undergraduate curriculum for the academic year 2019 onwards. When I saw this, I was so much excited, and I felt that there is something like my dream has been realized, and not only me, so many people have worked for this curriculum. If you see right from the days of 2011, when the Vision 2015 was published, there also there was a mention about foundation courses, electives, etc. And after that, I worked for a long time with the expert group. Here, I really acknowledge my association with the Medical Council and preparation of the competency-based education curriculum. I sincerely thank the support and encouragement I received in the Medical Council. When we are working in the expert group, I remember Dr. Rajlakshmi Madam, Dr. Ved Prakash Mishra, Dr. Tejender Singh, and support from Avinash Supe, Dr. Krishna Seshal. All these have contributed immensely towards the preparation stage of competency-based. Dr. Sajid, Praveen, Maulik, Dr. Vijay sir. All these have worked. We used to work late night and get up early morning and again start working on that. So I enjoyed that phase. That's why I was dreaming, and when I saw the gazette, I really felt the dream has come true. But now now I felt that should we still, are we dreaming or something has been realized or not, that I wanted to see. Now, before introduction, there was a lot of work which has gone into the preparation, and these are the significant contributions which have been made in National Faculty Development Program, because these people, faculty, are the key people who take forward this and implement the curriculum. So national, I did not mention all of them. NTTC programs, medical education units have been developed, regional centers have been developed, and basic courses are conducted for so many people, faculty, and nodal centers have done advanced courses. And there was a curriculum implementation support program, and there was also a task force on implementing the curriculum. Curriculum committees were developed, Department of Medical Educations were developed, of course, FIMAR fellowships were continuing. So these are all the efforts which have gone into preparation before the launch of the competency-based medical. Finally, we have seen this competency-based medical education. Very happy to see, and all these efforts which have gone in need to be realized. See, so I felt we'll have a check whether where we are going, which direction we are going. In this competency-based education, we have defined and included the attitude, values, and responsiveness. We have defined the roles of Indian medical graduate, clinician, leaders, communicator, lifelong learner, and professional. And also we explained to every faculty what is the difference, why you are introducing newcomer, what is the difference between the old and the new competency. We could explain them in one sentence, is that this is an outcome-based curriculum, and this focuses on the ability to perform in real life situation, right? This is how now we have to see whether these have been realized or not. If coming for implementation, as you know, India is having 706 plus colleges, and it has been implemented in all the colleges. Now, can we have a single opinion on that? No. So there are colleges which were doing some components of this curriculum even before being introduced by NMC or MCI. There are colleges which are struggling even today to implement the even minimum 10% of the curriculum. So I agree that we cannot have a single unified opinion about all the colleges in the country, but I know I have done some inquiries, right? And I have seen the implementation going on from 2016 to 2023. So these opinions which I am expressing in my talk are my pure personal opinions, doesn't represent any authentic opinions of any organization. So what has happened in implementation? 2019, we have taken off very well, very happy. We're all excited to start it, and it went off well in 2019. It is really a golden period for curriculum, competency-based curriculum. But when it came to 2020, March, end of the March, April started the lockdowns, etc., and it has hit us very badly. And so we were talking about competencies, we were talking about direct observation of the procedural side. How can we do total lockdown? 2020, 21 have gone like that. But 22, we have regained our posture and we have started. 23, completely, totally normal, and we have done full dedicated implementation. What has happened for COVID pandemic has come, we have immediately turned into some innovative methods, online modes. Yes, we have implemented the curriculum. Now, I don't say we have not implemented, but there are so many hurdles and we have to go for new methods, innovative methods, online mode. And also there were a lot of face time distribution changes were done to accommodate the last months. So 2021, we have new timetable, 22, we had different timetables. So there were some time distribution changes for first year, second year, third year. So that also has adversely affected our implementation. But taking all this into consideration, if we want to really wait till the outcomes like this student is able to perform in a real patient care mode, the competencies to be tested with the patient performance in the real life. We have to wait till 2025 where these students we are going to complete their internship. Now the students are in the final year in 2023. Now they are in the final year. They are appearing for exams now. So their internship starts in 24, ends in 25. But should before waiting till 2025 to see the real competencies in the patient care, we see there are a lot of components in this curriculum. And each component has a specific purpose, specific goals, specific objectives, each component. So we can take few components and see how far we could go forward. Can we see the outcomes of these components? Yes. Now, these opinions what are giving is due to my experience in implementing this right from every step in the curriculum. As the head of the institution, I have the opportunity to follow it up at every step. I was also closely associated with the implementation task force, which was there for curriculum implementation, during which we monitored the 2 states I monitored at that time, seeing in timetables of each college, and each week, each hour, what they are doing. And also had a lot of informal surveys. What has happened for this surveys, and when we give when we give a survey or questionnaire, what happens is all the colleges will say that we are implementing 100%. No one will say that we are not. So instead of formal questionnaires, I went out to informal surveys where I spoke to them personally and personal interactions. So all this combined, I am having some opinions about these outcomes, which I'm going to share with you. So let us see one by one what happened in the foundation course, early clinical exposures, teaching learning methods, family adoption, alignment, integration, skills training, ADCOMs, electives, student doctor method of clinical trainings, assessments, time distribution, phases, all these, each component I will try to analyze and see what are the outcomes of this. But as you know, due to time constraint, I may not be able to deal with all the components, but I'll try to finish it off in the given time. Right? First, I have taken the perceptions of the faculty. It was a informal survey, so let them give their opinions with anonymous, without giving their name or college. How much did you could implement in the 0 to 10 scale? And these are the outcomes. These are the results. The foundation course they gave 7.5, and the lowest one was student doctor method of teaching. All the faculty, this is only perceptions of the faculty I'm mentioning. This is not the total impressions outcome, but perception of the faculty they feel that foundation course they have done very well, implemented. And student doctor method, they could not do much, right? Overall implementation has come to 6.3. This is about the faculty. Let us go forward with each one. Foundation course. As you know, the foundation course was introduced to lay a sound foundation for pursuit of learning across MBBS and on their career in future also. And it had A, B, C, D, 4 components, which included all the orientation for medical profession, MBBS program, etc., etc., etc. Now, this is the main purpose of introducing the foundation course. Now, we'll see whether they could meet these expectations and the outcomes were there or not. The problems with the foundation course were, first barrier was that it was decided that it should be done in first 1 month. So then the problems have started because our admission process continued for more than 1 month. People were not coming. Students were very low attendance in first 1 month. And most of the students and parents also felt it is not an essential part of our curriculum. Foundation. And in fact, many parents used to ask me while the time of the admission, sir, when does the actual classes start? So even parents were telling the students not to attend, which is not a non-essential foundation course. So this is where the barriers. And one more barrier was faculty expertise. In early phases, there were discussions and who has to teach about the stress management or communication. So there was little time gap for the faculty to learn this and again do so. The faculty development program has played a very important role in training the faculty in these areas. And there were selective requirements. Not all require language skills, and not all require computer. There's some selective people who require, and we had to identify those students and do. There were some barriers. These barriers were overcome. Now the latest 2023 timetable shows that it is only 1 week. First 1 week is the foundation course, and it has to be spread over the 6 months. I think this has solved the problem as low attendance for first one, the admission process problem. They have been solved when we say that it can be continued for first 6 months, 2 hours daily, and 75% attendance also. Then one more interesting factor which has been included in this new timetable is the parents meeting. So I feel this is a very important part, and parent meeting gives us the opportunity to explain to the parent the importance of foundation course. So I felt this parent meeting is very important, and it has helped in overcoming the strategies for implementation of the foundation course. So the faculty has rated as implementation of 7.5. I have taken narratives and student feedback from the final year students who are there in the final year now. I have taken narratives because they are more representative of the opinion. Just giving yes or no or Google Forms, they will fill up everything, multiple choice like thing. So I went for narratives also. So when we asked, had the orientation to the structure, principles, goals, objectives of the curriculum at the beginning of the course, 93% of students said yes. 93. They said they know what is the principle, goals, objectives, curriculum, all these. They know that. In final year also, they remember them. When I asked them what is that, they could answer that. So I believe that they had this, and they remember even in final year. That means the purpose is achieved there. When I asked them to mention what they still remember the use of information technology has helped them in the foundation course. Foundation course has helped them for online research and self-study, self-directed learning. And they came to know about communication skills first time in foundation course. And some people, students have opined that they could learn stress management for exam purpose. So I feel the foundation course had a positive impact on the student, and it has achieved its objectives. Next came the early clinical exposure. The early clinical exposure purpose was to give context and relevance to what they studied first year. That is the first primary. Of course, the other two things are there, like clinical skills and attitudes. Most of them has happened in the classroom setting, and very less in hospital and hospital settings were possible because that time the early clinical number of hours were more than 90. For example, earlier at the time 90 hours were allotted, but in new timetable 2023 it is reduced to 27 hours. Now, how to overcome this problem is we can have classroom setting most of the times. This is happening now, and it will continue to happen. And this 7 hours means what used to happen earlier is I have seen the anatomy, physiology, and biochemistry, they used to divide themselves with the number of hours given here. 90 hours were divided for 3 subjects. But now what I suggested most of the colleges is please don't divide that. Once if you go there, you integrate with all the 4. That means if 3 hours they are going to early clinical exposure for the hospital visit, there they have to do the anatomy, physiology, biochemistry. For example, they see thyroid case, they have to tell about anatomy, physiology, biochemistry. So all the 3 subjects have to be covered in the given 2 hours or 3 hours, whatever time. By that, some of the colleges could overcome this time constraint. And in community setting also, sometimes it is happening not. Now, if you go to what is the faculty perception, they feel only 5.7 is the faculty perception given. But when I see the students' feedback and narratives, When I asked even in final year, they said they are able to correlate the basic sciences with clinical application. When I gave this question, 60% agreed and strongly agreed were 60%. Of course, there are 30% they could not tell anything that is neutral over there. When I asked them, okay, give me specific incidences which has helped you with the topic, name of the topic, they went on to write narratives telling that when the breast anatomy is being taught, they have shown a case of carcinoma breast case with lymphatic spread and told about the lymphatic supply of the breast. I still remember the lymphatic supply. This is the words they have used, students. When the liver and portal circulation is being taught, we have been shown a case of ascites and portal hypertension, which I remember today. So the final year students are giving these narratives of what has happened in early clinical exposure in first year. So what is the inference? So that is happening there. See, the outcome is there. We can see the outcomes. They are able to definitely tell the relevance and where they are going to apply that. So the early clinical exposure had very good effect on the students and it has achieved the objectives. That is my opinion. Now came the alignment and integration. This was a real challenge for all the faculty members because though we restricted and we have recommended only about the temporal share and nesting coordination and only, but still they could not climb till there. What has happened is earlier barriers were it has actually tested our interpersonal relationship. Earlier, anatomy people were not talking with physiology, or other departments were not talking. There were management issues where I have seen in one college without giving the names of the college, and management used to ask the faculty, "Why did you go to other department when you are so and so department?" So faculty were afraid to go to other department. But this alignment and integration has brought us together. All the faculty now are talking to each other. And where I'm very happy that they have developed so much personal relations due to this alignment and integration. No one is really isolated now. And alignment committees have helped them. And we have helped the university, has helped them in preparation of the timetable. Even the task force has helped each college to prepare the timetable and display it in the website. And we have scrutinized it and again gave feedback to each college on their timetable. And university had important role in giving these common timetables were given by some universities also. Really a cooperation. I am a clinician. I'm a general surgeon with due respect to clinical faculty. Little cooperation is more required from clinical faculty as far as integration is concerned. Another aspect is lack of trained faculty. The people feel that they are giving something, the surgeon used to come or physician used to come and tell about their treatment and their type of teaching in a preclinical classes. So this was little difficult to manage. But when the administrative support has come in, this has improved. Actually, instead of one professor of anatomy going and asking a surgery professor to come and talk, there was little problems in that. But when circular goes from office of the dean or office of the principal that so-and-so faculty of surgery has to come to this class, then definitely that will happen. So to have integration classes, the administrative support and also faculty to see the person who is coming should know what to talk. So faculty development programs goes long way in making this our alignment and integration successful. And faculty has rated alignment as 5.4 only. Students' feedback and narrative shows me that they have developed integrated knowledge. They say that yes, we had, and 57% has agreed on and strongly agreed. 31% were neutral on that. If I analyze all these narratives, what I feel is alignment, yes, it has happened. Alignment has happened. But integration and sharing, I doubt. Because, yes, in some colleges, again, the problem is our 700 and plus colleges, there are some colleges we are doing, they are doing nice sharing and also integration doing. There are some colleges which are not doing. But on the whole, majority, most of the colleges, alignment, yes, they are doing alignment perfectly. And all the first year people are doing, second year are doing all that. But little integration is being done here and there, not much, but okay, for the beginning, we should accept it. And I think training of the clinical faculty is more needed in this area. Then electives. Electives are very, sorry. Electives are very exciting things, right? I'm really personally involved in this electives posting. And these are introduced for sake of having diverse learning experience to do research, projects, stimulate inquiry, to choose future career pathways, self-directed learning experience. Why I'm mentioning all these is to see the outcomes, whether this has happened or not, and develop lateral thinking. So what were the problems with electives? There are main problem in electives was first step, identifying the topics. I've seen colleges giving, you are given electives in biochemistry. What is that? The details are not mentioned. And planning the learning, they are just posted there to do electives, and they don't have any plan of the day-to-day learning experience. So not all colleges, some colleges. So these were the hurdles. Some colleges have overcome it effectively. Sorry. And collaboration with external resources. So a collaboration with external institutions have worked out very well for the people, those who have utilized it. Most of the colleges could not utilize this opportunity well, but there are some colleges we have utilized, and our college, we have utilized this opportunity, and we have identified the preceptors also in the host institution. And this is the most exciting part for the students also. Let us see what is the feedback from the student. Faculty has given electives as 5.07, but students have rated it very highly. They rated topics are diverse, relevant, and useful. They could experience the areas of their interest, and they specifically mentioned what are the areas, and that has helped them in promoting the self-directed learning. If you see the specific feedbacks from the students, this is the sentences which they have mentioned. It gave the knowledge on what to choose. One student specifically mentioned that they want to do PG in hospital administration because he has gone to electives and seen it, and it was totally different, which he didn't even imagine that there is a such thing is there. And he specifically mentioned that he want to do PG in hospital administration. They have written, they have gained knowledge in new branch. For example, artificial intelligence. We have sent students for electives in artificial intelligence. So these have also elicited new interest in the students. And in intervention cardiology is one of the things which fascinated the students and helped in self-directed learning. And when we ask them what more you want in electives for the next batch, for the future batches, which we have to include any topics for suggestion, they suggested medical journalism. They suggested space medicine. They suggested sports medicine, organ. So even this, I could not think about medical journalism as a elective. So what is happening here? Yes, lateral thinking is happening. Career options, yes, they are choosing career options. PG in hospital administrations. That means they are choosing their career options. Lateral thinking is happening, and inquiry, they're inquiring, probing, self-directed learning. I think they, as far as my observations are concerned, the electives have very good positive effect on the student, and it achieved its objectives. Yes, when they have suggested all these, yes, lateral thinking happening there. Then came the student doctor. the less we talk about the student doctor method of clinical training, effectively implemented, in my opinion. There may be reasons, maybe many things. The student doctor method of clinical training was introduced to give them a longitudinal, immersive learning experience in a supervised setting. But uh, faculty had rated as 4.3. With due respect to clinical faculty, there is a lot of responsibility on the clinical faculty to improve this area. And student feedback narratives also are not encouraging. They're in turn asking me, what is this, sir, whether this has happened or not. This, my opinion doesn't apply to all the colleges. I agree there are one or two college or few colleges which might have done it very well, but majority, in my opinion, have not done well in student doctor. Maybe there are multiple reasons which is beyond the scope of discussion, but we need to improve on this thing. Next came the assessments. So formative assessment and another new word which has introduced is continuous internal assessment, summative. Yes, in CBME, the assessment has changed compared to earlier assessments, and it has a very good positive effect on the student. Why I'm telling like this is, in the timetable itself, in every college, when we have seen them, they have included one day as formative assessment day. This is a timetable which is typically prepared by our college. They have made formative assessment as Monday morning, 1 hour. So one day pharmacology, microbiology on rotation. So they have incorporated the formative assessment into the timetable one. Lot more has happened after this. These timetables were prepared 3 years back, but lot more has happened. In every class, the teacher is giving 1 or 2 MCQs before the class. They are giving 4 or 5 questions after the class, and immediately they are getting the formative assessment done in the classroom only. And I have seen teachers using Google forms, giving the questions, and use students immediately replying in the classroom at the end of the class. So technology is being used, and I've seen most of the colleges are doing the formative assessment and giving the feedback. This was important, giving feedback to the student. This is happening. Yes, assessment, the faculty has given a rating of 6.5, high rating, but students' feedback and narratives is also good. When I asked the student, did you receive feedback? Yes, they said. When I asked them to write narratives, some of the students have written so well, it surprised me that they mentioned that all the domains are being tested. These words I have not heard in the students before this competency-based education. They themselves have mentioned that yes, ATCOM is being tested, sir. All the domains, that psychomotor, and they mentioned that these words, all the domains. I think this is a positive change we have seen. If assessments are done well, I think definitely the implementation of competency-based education will be very good. And I'm really satisfied with the assessment, and universities have a very important role in that. I agree. And another challenge has come for us is to align our assessments in alignment with the future assessment. That is, I'm talking about the exit exam. So these assessment challenges are there, where we have to align our present assessments in all the years to the exit exam. That is a real challenge. But the MCQs also have been introduced in most of the universities. This is fine. Now, next, ATCOM. Outcome, as you know, with the intention of attitude, ethics, and communication skills to be good communicator and professional. Outcome, the faculty has given a rating of 6.6. That means they are satisfied. They are most of them are implementing. What were the barriers? Initial barriers were who should teach them. That was the initial early barrier because there were issues like communication skills were there, stress management was there. So they were confused of the initial first year, second year. But now that is resolved, and who has to train has been well defined. The faculty development programs have clarified that we have separate outcome workshops have been done on a separate day, full day outcome workshops have been conducted. Now we are doing part of the basic course. And also in the recent this year regulation, the attitude, communication skills, and competencies also have been divided and assigned to particular subject. For example, surgery people will teach one competencies number 1, 2, 3. Medicine will teach 3, 4, 5. Gynec will like that. It has been mentioned. Sorry. So this has been resolved to most of the extent, and students' narratives are also good. They say that they have learned communication skills. And one student has specifically mentioned that, sir, communication skills I have learned not only with the patients and doctors, I learned how to talk to my colleagues also. So these communication skills, we targeted actually communication skills with doctor-doctor communication, doctor-student communication. But between the students also, they had this communication skills they developed. They told me that, yes, sir, we know in better we are talking about the students also. Next is attitude, because the attitude little difficult to assess now at this stage. I can't comment on that. Sorry, my throat is not 100% fit. So this may take more time. Attitude, I cannot tell now. This is a timetable which has, reflects what has gone on from 2019 to 2023. The phase 1 months were 14, 11.5, 13, 12 months like that. Now 2023, now we got stabilized here. These are all changes were made to accommodate the months which we have lost in COVID year. But now at least in 2003, I think it is stabilized now. I think the final column shows that it is the final year. This, I think, will stabilize now our system. Otherwise, there is a little difficulty in adjusting for the faculty and planning things, and preparation of the timetable was also a problem. I think that will get resolved from 2023. There will not be any changes. Now, looking at all the picture, what is my suggestion? To have a best outcomes for competency-based education, we should further focus on faculty development program. What does I mean by faculty development? It is not that what we are doing basic, we are doing now basic course in medical. That is not sufficient. For example, if you see student doctor method, we talk about half an hour or 1 hour in student doctor method of teaching. That is not sufficient for the physicians to pick up that and implement it. The faculty development programs have to be designed by each institution, focusing on each component, at least 1 day, 2 days program. On each component, let us focus on, for example, you have integration. Let us have focused integration workshop for 1 day or 2 days for the faculty so that they will implement it. It depends upon the institution. student doctor method. Yes, we need to have more workshops on that, and also they should be focused for whole day. Then adopting technology. We need to adopt technology. Now, we have seen that happening, for example, formative assessment, I told. I've seen uh, I've seen colleges which ban cell phones in the classroom. Yes, I've seen colleges which are using the cell phone as a teaching methodology and also for having formative assessment. In our college also, we give questions in the beginning of the class, and at the end of the class, again we share a Google link, which all the students will reply the questions, and we know immediately we are seeing that. So, adopting technology will definitely help us in implementing the competency-based education more effective, and also giving feedback to the students. And another area which we can focus for better implementation of competency-based education is the academic support system. The curriculum committees are there, and each component like integration committee is there. Another this so every phase committees are there, but for the faculty to come in line with our curriculum, we need to have a definite circulars from the administrators like a dean, principal, or management. They are all to have to come and support the medical education department so that they will effectively implement it. This is very important. Otherwise, we cannot correlate. For example, integration, if you want to happen, we have to catch hold of the clinical people and do it. And another is designing a standard assessment pattern. We have some institutions, most of the institutions have some standard assessment patterns, but this has to percolate into every class, every session, every class, every teacher. Then only we can have this. So I feel these are the strategies which we have to adopt for having more and more effective. I have not covered some of the components like family adoption program, which has been recently introduced. That also is being partially implemented because there is again time constraint in that first year. So, if you ask me whether there is a realization of the competency based base, still we are dreaming about that. When I thought about this topic, we are still dreaming in competency based education that is going to come, going to happen or not, whether something is happening, whether students are really getting benefit out of it, or should we wait till 2025 to see that? But my observation now is whether the realization is happening or not. Yes, it's happening. Yes, it's happening when for example, electives you take, when they are telling about their future careers, yes, it is happening. When they are telling relevance for their anatomy, yes, it is happening. So I feel that, yes, it is happening. Now the question is to what extent? To what extent? See, for any change to happen, it takes time. We should be happy that, yes, realization is happening and areas of concern are there. We have to address them, agreed, but we are in the correct direction. We are going in this direction. That is my final opinion. So let me thank all the medical teachers and students who have contributed for this presentation, including all the colleges, more than 40-50 colleges. I have collected the data from them, spread on more than 8-9 states. But I thank all the medical teachers, students who have participated in that service. And also my sincere thanks for MCA and NMC and the curriculum implementation task force in which I was working. Department of Medical Education, Bhaskar Medical College, which has compiled all the data and helping me daily in preparation of this presentation. I sincerely thank the organizers and MU India for giving this opportunity for me. Right? Thank you. Thank you, one and all. Right? Sir, are you able to see my? Thank you, sir.
Thank you, sir. So now we thank Dr. Chalam for giving this lecture, and on behalf of MU India and its members, we feel great honor in conferring the Lifetime Achievement Award on Sir, and also we give him the Dr. Rita Sood Memorial Oration for delivering this talk. Thank you, sir. Thank you very much. I mean,
thank you, sir.
It is very refreshing that bringing all the data together, and yes, it's happening and it's taking time, and we are sure that with everyone's efforts, India will reach a stage where it will be the world leader in medical education and health. We are 1/5 of humanity, and we have certain responsibilities to this planet. Thank you, sir. Thank you for the talk.
Thank you, sir.